another episode of Voices That Shift You. I'm Arya Nair, life and career coach, founder of DYC, that's Discover Your Calling. And in this series, I bring conversations to you with inspiring voices that shift perspective, awaken possibilities, and open doors to new ways of living and healing. Today, we are diving into a subject that beautifully bridges between science and soul, pranic healing, with someone who embodies the balance in the most authentic way. Our today's guest is Dr. Prachi Renjhen, professor of gynecology, women's health advocate, a healer with 25 years of work experience. Dr. Prachi has dedicated her life in women's health with special focus in adolescent care, fertility, and birth psychology. Beyond being a seasoned clinician and educator, she's also a certified pranic healer and pre and perinatal psychology educator. What I deeply admire about her is her work, how she seamlessly blends between modern science and holistic healing, empowering women at every stage of life. In fact, some of you may remember when Dr. Prachi and I had a Instagram live on gynecology and fertility. Our discussion on pranic healing sparked such curiosity that we felt that this subject deserves an exclusive conversation. And that's exactly what we are going to do today. So let's get started. Welcome, Dr. Prachi, to this conversation. I'm so happy to have you here today.
Thank you so much, Arya. It's a pleasure to be back again with you. And I hope this session enlightens many people around.
Beautiful. So before we get into deeper version of pranic healing, I would like to understand that you began your journey as a doctor, as a gynecologist. So what led you to explore pranic healing, and how did that shift impact the way you view health and healing today?
The story is very interesting of how I got into pranic healing. I was teaching at Sikkim Manipal Institute of Medical Sciences, and this is 2005 and 6. And, we were having a CME program, and then our director said that there is a speaker from Hyderabad who would like to enlighten us on a newer modality of healing. So we were all very, curious to learn this new modality. And so this was one Malaji who came and, she gave us an orientation as to what is pranic healing. And then, she said that, okay, is there anybody who needs healing? I will do a free healing on the stage, right? So somebody said, I have a headache. Somebody said, I have a backache, and she would wave her hand and, the healing, they would say, we are feeling fine. So then one of the doctors, no, he said, okay, ma'am, this is okay, but I have a patient and I want you to heal that patient. And this patient is having frozen shoulder. So from the ward, we wheeled in the patient and he was 65 years old, Babaji. So it is, Babaji, raise your hand. Babaji couldn't move his shoulder. So on that stage, Babaji was sitting and Swan Manaji waved her hand and she waved a crystal. For 15 minutes, she did the healing. And then after 15 minutes, she says, Babaji, move your hand. And Babaji did this. You wouldn't believe it. We were 100 people sitting in the auditorium. There was 25 faculty members and 75 of students, right? And my expression was, she has hypnotized us. This is not possible. Okay. So, and she read my expression, right? And she says, anybody who wants to learn, I'm willing to teach you. You won't believe all 100 of us registered for a course to see what pranic healing was. I mean, we thought, this is a trick to hypnotize us. How is this possible that somebody in 15 minutes would just move their arm, right? And then within 15 days, I went to do all 3 levels and then beyond. And over is 20, I mean, 20 plus years, I've done almost all courses in the school of pranic healing. Yeah.
Wow, I mean 2005, 2006. That's such a
Yeah.
long time, like 20 years.
Yeah.
And
And I've doing it on most of my patients, my family members, myself, not a day goes without pranic healing being used in my life.
oh my God, I mean, I have recently come across this modality. Okay, so maybe my exposure is very different to others. However, I didn't know that it was so common in medical science. Like, it was introduced at such an early stage in medical science. I thought it's a very, you know, recent trend of, blending science and, how would I say, the traditional aspect of healing, because this is all historical and it's always there. It's just that we are not exploring it, right? So I really thought that, because Manipal is one of the old institutes, and it has a lot of, I would say, reach, right? Like, they have a lot of branches, and so okay, that's very interesting. So how do you see that pranic healing in science or in medicine has evolved over a period of time? Is there acceptance, or how? What is the level of understanding in terms of doctors on this area?
Yes, many doctors, many nurses are now practicing it. See, this pranic healing is actually a very, very old science, right?
Hmm.
In 1988, 87, Master Chow Kok Sui from Philippines, right? He made this public after having experimented on these healing modalities. He was actually a chemical engineer by profession. So he would not take anything blindly. So he experimented on all these techniques and then, he made it publicly open for everybody. So he wrote books and, those books are available on Amazon. But then people felt, that this needs a course kind of a thing. So then he devised 2 days courses where he would give hands-on training. Right.
Okay.
So many doctors, many nurses went through this. In certain countries, in US and in Europe, this is a part of their nursing curriculum as well, right? So even in India, many doctors have done it. I'm one of them. And I have introduced it to my medical students. So I think over 100 of my medical students have, in last 5 years, taken this course. And now we are introducing it to the nursing students this year. And few nurses in my institution have also taken pranic healing and they're practicing it. So the acceptance is there, yes, and it is growing.
It's fascinating to see that, because I had no idea about this having coming, because I come from a healthcare background. Um, I don't think I have read about pranic healing in any treatment algorithms or treatment guidelines per se. So it is not even mentioned as non-conventional therapies on treatment guidelines till now, or are they for certain conditions?
See, pranic healing is a complementary
Hmm.
modality, right?
Right.
Now, medicine, when we deal, the Western medicine that we study, it's all about, making a diagnosis and giving a treatment.
Yeah.
So there they do not bring in the complementary therapies.
Okay.
Okay, but if you know the complementary therapy, then you can add on with the medical management and speed up the healing process.
Okay. So, just to understand a little more on that, how does this work? Do you have a multidisciplinary team inside that, a person who also is a planic healer, or do doctors recommend sometimes, like, you, hey, you can also go for pranic healing during your treatment, or how does it work? Because I know that when there is a condition, you do have teams, different specialists, come together and everything, but then where does pranic healing fit? Because there are certain conditions where, acupuncture is suggested sometimes, or, you go to a dietitian, you go to a nutritionist. So I'm just trying to understand, where does pranic healing fit there?
Yeah, now depending, if you have a pranic healing set up in the institution,
Mm-hmm.
right? Then you can, ask the patient, refer the patient, okay, go to a pranic healer in the institution itself, right? Which is there in many institutions abroad, right?
Okay.
Now, in our setup, we still don't have this kind of a facility in the institutions. But see, people who are like me, they know about it.
Hmm.
So if I have time, I'll tell the patient, okay, I'm going to do a healing for you. Are you okay with it? But if I don't have time, I'll say, okay, fine. This is another modality to speed up your healing. Contact this healer. I mean, refer them to Pranic, right?
Okay.
And see, people who have chronic problems, we encourage them to learn pranic healing and do self healing. Then they don't have to be dependent upon anybody because you can heal yourself, right?
Right. Okay,
So
that's interesting.
why depend on somebody when you can do it with your own hands?
That's wonderful because I didn't know that hospitals can have in-house pranic healers as well. So
Yeah.
that's one gap in India per se, where that could be included, and that would be helpful in terms of referring patients to them, as you would already know, right? Their
Yeah.
background and everything. Okay, that's interesting.
See, pranic healing is there in 120 countries in the world, right? In India, almost every state and most of the cities have one pranic healing center,
Mm,
and they have healers around. So, if you Google up and say a pranic healer near me, I'm sure somebody would be
come
there,
on.
help you and assist you. And some center would be there. So I don't think it's just a matter of people being aware about it and then using the services of pranic
So,
healers.
what is the origin of pranic healing? Where does it come from? Is it Asia or somewhere else? And are you
It's
aware?
very, 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 very ancient science, and it has reference in many, many uh, Chinese as well as Indian older texts. So Master Chow Kok Sui actually experimented with this.
Hmm.
He used these techniques, he experimented with this, and then he actually uh, made it public. Because earlier it was, only certain people knew this art,
Right,
So he said, no, this needs to be made public. Why should
right.
only people use this magic of healing, right?
Right. I think
Yeah.
back in those days, the knowledge was transferred verbally more rather than, writing. And of course, those days when we call them doctors and scientists, only they were trained in those things. And like you said, when one master comes up and takes the decision of noting them down and passing the knowledge to the world, that is when there's more knowledge and more buzz around that
Yeah.
concept per se.
Right.
And
I mean,
then
I
there,
can give
yeah.
you examples from, Christianity, from
Hmm.
Hinduism. There are many.
So it's just cross. Okay, then that's interesting. Maybe that was always there across the world, and it was just not, functional, cross country, cross continental. It's there, which means it was very
Yeah,
normal back then.
it's something which is very universal, but yeah.
So I think maybe the things that they called magic back then was actually healing. You never know, right? A form
Yeah,
of
absolutely.
healing. Yeah.
Absolutely. Yes. Yes.
So it's just a lack of knowledge that we have to name things. That's it.
True,
Okay.
true.
So, Dr. Prachi, tell me, for those who are new to this concept, what exactly is pranic healing and how does it work with the body's energy system? I would love to know about that.
Yeah, now before we go into that, let me tell you some interesting facts, right?
Hmm.
We all see our physical body, but let me tell you, we have more than one body, all right?
Yes.
So we have an energy body around us,
Yeah.
right? Which is the body which is running ours, okay? So this pranic healing works on the level of energy body, which is something we cannot see. It's an invisible body. So
Hmm.
like we have blood vessels which carry blood, similarly, this energy body around us has meridians, right? Uh, which we call nadis and chakras, right? So points where the energy body would interact with the physical body.
Okay.
I'll give you an example. Now, this meridians and chakras are also used by acupuncturists and right. So they also use these for healing. Now, the difference is in pranic healing, it's a no touch, no drug therapy. You just use your hands, and that's about it. But you don't touch the patient. Okay? Because we are dealing with the energy body. Another example of energy body is when you meet somebody, the person has not even said anything, and you feel you don't want to talk to this person. And there's sometimes you just enter a room and you say, "Oh wow, I want to talk to that person." Now that is the energy of that person that is different, right? Why you get
Mm.
attracted to a particular person and why you don't get attracted. But we can't see
Yes.
it, right? So this aura that we say is actually our energy body. And what
Okay.
happens in the energy body? will reflect on the physical body, and what happens in the physical body will reflect on the energy body. They are so intimately linked. Right? As I
Mm,
said, these chakras are points which connect with the endocrine system. For
mm,
example, we have a chakra here, Ajna chakra, right? So this chakra works at the pituitary level. We have
okay.
a throat chakra which works at the thyroid level. So all the endocrine glands are actually uh, responsible for taking this energy and then working on the body. Now, if there is any block in any of the meridians, then the energy flow is disrupted, and that is the cause which will result in disease. So once you clear the
Mm,
block, you allow the energy to flow, the healing actually happens.
okay.
Right? Now, the body actually has a mechanism of self-healing, right? You get a cut and it'll heal in 5 days. Right? But suppose I energize that part and give the cells more energy, they will heal faster. So pranic healing is nothing but, giving energy to that part and speeding up the healing process.
Okay.
So that is exactly what we do in pranic. We just remove the diseased energy, charge it with positive energy, and accelerate the healing plan. So something which is going to take 5 days is going to take 2 days. Yeah.
Okay. So, when you call block in any of the chakras, so how do
Mhm.
you define block? I mean, what is block basically, and how can
So
you give me? Yeah, yeah.
the flow of the energy is not going through. So when
Mm,
you learn pranic healing, they will actually teach you how to scan your energy. Right? So you learn to scan your energy of your body. You learn to scan the energy of each of the chakras, right? You learn to scan the energy of the area which is paining or has a disease. And then you know whether it is because of a congestion or a depletion of the energy. And then they teach you how to remove the diseased energy and charge it with positive energy.
so you can scan your
This
own energy also. I mean,
You can scan
mm,
your own energy. You can scan somebody energies, like somebody sitting in front of you. You can scan the energies of somebody in America. Because everything is energy. So we are in an energy sea of energy, right?
right.
And we have an energy body which is actually swimming in the sea.
So,
So
you also can do online. So through online, can you feel the energy? Oh,
yeah,
okay. That's
you can,
interesting.
even if you're not there in front of me, I can scan your energy. If somebody from America calls and says, Dr. Prachi, I need healing for my headache, fine, I can do that. I don't have the person standing next to me or in front of me. I can do it.
That's fabulous. That's fascinating, I would
Yes.
say.
So I think this motivates you to do the course.
Yeah, and like I remember in our previous Insta live, we discussed about like that was more about fertility and gynecology. So we were discussing about how each chakras and like based on the chakras we have exercises or yogas, asanas, whatsoever. And when we do certain exercises, how it directly affects a specific chakra. And how it can actually open the chakra and regulate a hormonal level. So when you were explaining all of these things, I could feel the correlation. So I'll just give you a very recent example. I was traveling for quite some time last few weeks, and when we travel, exercise is like, although you can walk, you end up walking because you're traveling, but the stretching part and certain things you end up not doing, or you end up missing it out. So I remember I was doing this one type of exercise where it was focused on my back and my thigh region and all those things. And now, like when you are a life coach and when you understand about energy, your own energy, like when it is down, when it is high, I felt when I was doing that, I started crying. So
Right.
I feel that maybe I could see that when I am doing those exercises, I felt that I'm releasing those energies. Maybe,
Yes.
maybe not, but that's how I could correlate, because there was no reason to cry. It was just like that, and then I was finding reasons to cry, and then I was crying, right? So your logical mind wants reason. Why are you crying? Acha, theek hai, purana kuch leke aata hai, and we'll start thinking and we'll cry. So that was very interesting, and when I was literally crying, I was thinking about you, saying that, you did mention when you do this exercise, it can open your chakra, and, the energy is releasing, and maybe it's, then I told myself, oh, maybe this is overwhelm of energy or something like that. So can that be a reason?
Absolutely, absolutely. So when you do any kind of an exercise, dance, walk, you are actually, moving the energy in the energy field. So
Hmm.
automatically your people say, no, we go for when we are stressed, we go and do a dance and we feel better, or we go and do some gymming and we feel better. Why? Because, when they go, they gym, the energy from the aura, the dirty disease energy is, released, and they get free, fresh energy, and so they get recharged.
Right. Right. That's
That's
wonderful.
another perfect, your energies got released. Yeah.
Yeah. So, like, you work with many women with pre-fertility and fertility stage, right? Like we discussed previously as well. So, can you now let us understand how can pranic healing support women's reproductive health, both physically and energetically?
Yeah, see, definitely when people have infertility, there is a physical component to it. But more so, there is an emotional component, right? There is a lot of stress. Now, these emotions actually land up working on our emotional body
Mm-hmm.
and the chakras, right? So they affect the hormones again because of your stress. Your chakra gets congested or depleted. The particular organ next to it, I mean, which is influenced by it, gets affected, and the whole hormones in the whole body get affected. So once they do pranic healing, not only are we healing their physical organs, but we're also healing their emotional state, and helping them balance their chakras, balance their hormones, and prepare the body to receive a new soul.
Okay.
A lot
Okay.
of childhood traumas, a lot of unresolved traumas, all these are there, which we are not aware of, but
Yeah.
they are a cause of infertility somewhere.
Right.
So having cleared them up, people have very good response.
Okay. So, like sometimes they say, right, when a couple is trying to conceive, and if there's a lot of stress from the family or anything about work or anything, then the chances of conceiving is lower because of the stress. So it is somewhat related to this.
Absolutely, yeah. So because see, once the person is stressed, the ajna gets affected, and this hormone is this chakra is related to pituitary, and the
Hmm.
pituitary is a master gland that controls the whole reproductive axis. So once pituitary gets affected, everything gets affected. So once you remove the stress, your ajna gets corrected, the rest everything falls into place.
Okay, so one more thing. I would just like to understand about stress now. Okay, so there are two things, right? One is you have stress, like, stress, like you are scared about something, your head is bursting, or you have a lot of thoughts in your mind. And sometimes it's just thoughts. So you are
Hmm.
not very much concerned about it. There are thoughts that just come and go, but then that would not raise your heartbeats, or you may not keep on thinking. It might just briefly come once in a blue moon, and it might just go. And then there is stress, like, you are always hyper, you have anxiety, and or in general, like, you are concerned about something. So the second one, can is that more impactful, or is that okay? I mean, what is the level of stress one can have is what I'm trying to understand.
Uh, that would depend on each person, right? We
Body.
create 1,000 thoughts in a day,
Hmm.
right? Now, it's again, these thoughts are energies. So the more you feed a particular thought, that thought is going to disturb you,
Okay.
right?
It's
And depending,
frequency of thoughts. Hmm.
yeah, how much? Because that is very difficult to say, because you can't read anybody's thoughts, you can't read anybody's mind, right? You might just feel I'm just thinking once in a day or twice in a day, but actually it may be more than once or twice in a day, right? In some way or the other. So we really do not know. And what is your internal dialogue when that thought is happening,
Hmm.
right? Are you able to overcome that dialogue and say, no, it's okay, I can handle it? Or are you getting overwhelmed with that thought?
Yeah, so the
feeling
response.
feeling hopeless. No, this cannot be me, and I don't think I'm capable of having or bearing a child. Something is wrong with me. So that internal dialogue that goes on, which is a negative dialogue, it's a negative energy. That's going to affect your hormones.
Ah, okay. Now I have some more clarity on that. So, like we just discussed about stress burnout, right? So how can pranic healing help with emotional release and mental clarity? Like, more about mental clarity, I would like to understand. How does it help with that?
Okay, I'll tell you. Pranic healing is in three levels. Okay.
Mm-hmm.
The first level, when they teach you how to scan your energy body, right? And clean your uh, dirty, diseased energy and charge it with positive energy. You can heal simple illnesses, right? A second level, they teach you how to use colors, energies to enhance healing. And in the third level, that is chronic psychotherapy, we learn how to heal our thoughts and emotions. Okay. So, because we have an emotional body and a mental body where our emotions and thoughts live, right? So there is a technique to remove these stressful emotions and negative thoughts and charge them with positivity and heal a person.
Okay, that's
So
that's
once you have sorted out your stress and your negative thoughts and negative feelings, that is going to have a positive effect on your mental health, emotional health, as well as physical health.
okay. So of course, like when you have lesser clutter in your mind, that is when you have space for clarity.
Yeah,
Mm.
absolutely. So if there is
Yeah.
a dirty, if there are negative thoughts just going on and on and on,
Mm.
and you charge them with positivity, so obviously your mind becomes very clear.
So,
It's like, you have a mirror with dust and you just remove the dust.
clean it.
So obviously you're going to see, you're going to have a clear vision, right?
Yeah. So, like now I'm very interested to understand how do you do it. So, do you have any tools for that,
No
or
tools.
no tools? You did mention about crystals. Some people use crystals, or
Yeah,
how is it?
I mean,
Yeah.
basic thing is that you use only your hands for all
Mm.
these three levels. If you want to enhance your healings, then
Okay.
you can program crystals which will make your healing faster. But if you
Okay.
don't have a crystal, doesn't mean that or you don't know crystal healing. Doesn't mean that you can't do pranic healing. Majority of us just use our hands.
Okay. So, one more question. So, when you are healing someone, there could be an energy exchange, or does that happen, or that doesn't happen? First question.
Okay.
And
Yeah.
after that, like, how do you heal yourself? Do you do something after each session so that you are like your energy is protected? Like, what are the practices that you prefer
See,
doing?
as a healer, we are taught, to prevent contamination. So we are taught that, when you're healing, how to decontaminate your hands, right? And,
Okay.
throw the dirty energy in a way or dispose it off in a way that is not going to contaminate you much,
Mm,
right? And then after that, healers are again taught how to decontaminate
cleanse.
cells. Yes. So we are taught that. But nonetheless, we are not using our own energy to heal. We take the energy from the cosmos. It's a universal energy, right? So it's not that if I'm healing, I'm going to get depleted. No ways. I am just removing energy and charging with the positive energy from the cosmos. So my energy is not anyways uh, getting used up. But yes, there are energy links, but we are taught how to, disconnect from the energies and stay healthy.
Okay, now I understand. So it's not basically your energy, it is from the cosmos. Okay.
Yeah.
Okay. And you do it in a normal setting, or do you have any environment? Like, for example, I am your client as a for pranic healing, and we are doing this kind of conversation. So this conversation is enough for healing, or do you have a setup, like,
No, I
nothing?
don't need setup. I just need a disposal unit, and I
Okay,
just can, you
that's
know,
it.
sit
Yeah.
anywhere, quiet place, not being disturbed by many people.
Okay, because
And
I remember taking a session. I'm not sure if it was a healing session. It was something on certain concepts of various elements, and it had little bit of meditation, which also had an element of healing. And when I was meditating, I could see some different things, like some, I don't know, some shapes in front of my eyes, and everything that never happens. And I could also, when that was happening, I could feel, like when the person was saying I disconnect, like if there is any exchange, I call that back, or I don't remember the exact words, but whatever energy is, we disconnect from each other and we call back our energy and all those things. And I remember him using his hands little bit. So it was a small session, like we do some kind of guided meditation, but little bit of healing in that. But I think I'm little bit able to correlate with what you're trying to say. So okay, so that was basically a virtual form of healing then, right? Where your eyes are typically closed and they're guiding you with something, and maybe like, yeah, using their hands also, right?
here, when we are doing the healing, we are just doing the healing, right?
Hmm.
There is a separate meditation which is taught in the school of pranic healing. It's called meditation on 12 hearts. And it's supposed to be like something called like, spiritual shower. I mean, that's what they say, right? It's like every day you take a bath and, you do twin hearts meditation, you're all sorted out for the day, right?
Right.
It's actually supposed to recharge you, take care of your stresses, take care of everything. It's an all-in-one kind of meditation. So yes, we can, when the patient wants, they can do that meditation. We can play that meditation, but per se, when we're doing the healing, we're doing the healing.
Okay.
Yeah.
Okay. So, can you let us know what, like, this is one last question I want you to ask, most important, I believe. What are the few simple practices or energetic, hygiene habits, other than, like you mentioned, about a disposable box or decontamination? Simple practices or energetic hygiene habits that one can start using right now to feel grounded, balanced, not as a healer, but as a person per se, and in tune with their bodies. Like, even if I'm not a healer, so how can I, keep myself grounded and stay aligned with myself?
Right. So, one of the most simplest thing is to take a salt water bath, right? Or when you come back from work, just wash your feet nicely with salt water. That's
Okay.
the simplest techniques to kind of get rid of dirty, diseased energy. The other thing is, you can light up sandal agarbatti, incense stick, sandalwood, right? That
Mm-hmm.
has a effect of decontaminating the place, right? So you
Okay.
can contaminate your room. You could play Om chant and decontaminate your room as well as your aura with an intention that when you're listening to the Om chant, it is uh, removing all stress energy from your system. So
Okay.
that can be done. Walking barefoot on the ground, green grass, that has a very, very good effect of taking prana from the ground and energizing the stuff. There are many
Okay.
techniques actually. Eating, clean food, right? Uh,
Right.
right? Clean, fresh food, fresh fruits and vegetables. Yeah. Avoiding stale food is another way of improving your energy hygiene. And uh, I mean, I've been doing Twin Hearts meditation for past 25 years now, so that's my meditation. But yes, any kind of meditation that suits you is a good technique to recharge yourself.
Okay. That's beautiful, because I have personally observed, when I walk barefoot,
Yes.
I feel more grounded and aligned. So yes, that's something I have. I also sometimes listen to sound healing music sometimes, so that does help me, my room feel little more energy wise cleaner. So I think, yes, om chanting, sound healing does help sometimes. That's nice to know. And so you said that sometimes even if you wash your feet with salt water, that is also enough.
Yeah.
Okay. I thought it's the whole, like, you need to take a bath. Yeah.
Ideally, yes, ideally, salt water bath is
Hmm.
recommended. Suppose you can't take it, then at least wash your feet with salt.
Okay. Okay.
Say you
That's
come
good
back
to know.
home from office, you're very stressed, you're very tired, you're too lazy to go into a bath. Then all that you do is just take a handful of salt, rub it on your feet, and just wash. Or if you can
Oh,
soak your feet in salt water, better.
even
And
better.
you will actually, you can experiment. Don't believe what I'm saying. I suggest please experiment on your own and make your own conclusions, right? This
Yeah.
is one thing that we are taught, that pranic healing is, all experimental and experiential.
Right.
Even with the classes, no, it's very little of lecture. It's all experiments on each other. We experiment to scan each other's energy, remove dirty energy, scan. So it's all practical. Only if you feel that it works, it works. Not
Wonderful.
because I'm saying, not because I'm saying.
Yeah, I mean, I think the work works. Only when you try it, you know it. But then, thank you so much, Dr. Prachi, for this enlightening conversation. Because what stood out for me, and I'm sure many of us, those who are watching, is the possibility of truly seeing health as not just absence of disease, but a state of balance between body, mind, and energy. It's holistic, right? And for all those who are tuning in, if this conversation resonated, take a moment to reflect on the practices that doctor shared. Healing isn't always about big leaps. Sometimes it's beginning with small, consistent shifts in awareness and energy. Like she said, it's all about trying, and only when you try, you know what works best for you, right? So this is exactly what Voices That Shift You is about: stories, wisdom, and those things that help us expand our lens on what's possible. So, thank you so much to all the audience. Thank you, Dr. Prachi, for your time, wisdom, and until next time, stay grounded, stay curious, stay connected to your inner power. Before we close, Dr. Prachi, do you have any final notes?
My biggest regret was that I wish I had learned this when I was in medical school, right? Because I feel I would have done much more, had I known this earlier. And as you rightly said, it's all about body, mind, and soul. And knowing our own energy, being aware of our own energy. And this is in future going to be one of the major modalities of treatment and healing.
Wonderful.
So people can experiment and try this. I think it's going to be really beneficial for them.
So
And
on
thank you.
that note, I would like to end saying that this is something that the medical science is going to watch out for. It's going to be a boom in the industry and in the healthcare sector. And let's see how things go. So thank you so much, Dr. Prachi. I am grateful
Thank you
for
so
you
much.
to join.
Yeah, pleasure. Thanks.